I'm Dr. Rochelle Walensky, Director of the United States Centers for Disease Control and Prevention and ATSDR Administrator. I'm delighted to join you in this important discussion of public health in the context of the Transatlantic Partnership. If there's anything we have learned this year during the COVID-19 pandemic, it is that our world is interconnected, and what impacts the health of one of our countries impacts all of our countries. Indeed, perhaps the greatest lesson from this pandemic is the critical need for global collaboration. I am deeply pleased by the long-standing relationship between the United States and the European Union member countries, and between CDC and the European Ministries of Health. Our long-standing efforts to jointly address global health threats have primed us for this moment in our collective history. During the pandemic, our collaboration to share critical scientific information has saved lives. In the beginning of the pandemic, we shared information on how to detect the virus, how it was spreading, and what was working to prevent the virus from ravaging our communities, our cities, and our countries. As the pandemic evolved, we shared information on the disease tracking, on data and analytics, and on genomic sequences that have helped us collectively understand how virus variants are emerging. And recently, we've shared information about vaccine technology, vaccine distribution and administration, and data on our vaccine safety monitoring efforts. Through it all, we have followed several guiding principles. Follow the science and data, and ensure that our efforts are evidence-based. Be transparent with each other and the public, and build sustainable systems and infrastructure to not only address the issues of today, but also to prepare us for the future. Last year, CDC released a strategy for global response to COVID-19. The strategy defines CDC's efforts to address the urgent need to prioritize our global response work and to reduce the global burden of COVID-19, while continuing to build global capacity to prevent, prepare for, and control future pandemics. Our plan over the next 2 years is to focus on 4 strategic objectives. We are providing support to strengthen global capacity at the country and regional levels to prevent, detect, and respond to COVID-19. We are working to prevent and mitigate transmission across borders in communities and healthcare facilities. We are working to contribute to the scientific understanding of COVID-19, including adding to the global body of literature on clinical severity and long-term sequelae and immunity. And lastly, we are working to increase national and global readiness to implement and evaluate vaccination programs and use of therapeutics when available. I want to close with an issue that drives me and motivates me and everything we do at CDC. A stark lesson from the COVID-19 pandemic in the United States is the disproportionate impact that the virus has had on certain populations in our country. And still, we must recognize that the US and EU have been fortunate to access technologies, such as laboratory diagnostics, therapeutics, and vaccines that have benefited all of our citizens. The virus knows no political or social boundaries. If we want to truly turn the corner on this pandemic, we must be good citizens of the world and assist our global partners in their time of need too. The United States and CDC look forward to working with the EU member countries on strengthening the World Health Organization and on our collective efforts around the globe for the benefit for all of us in the future. I look forward to a day when we can return to some sense of normalcy and when I can deliver these comments live in person in the EU. And I look forward to our future collaborations for the health and safety of all of our people. Thank you.